I'm Casandra Williams. I'm a certified environmental infection control consultant with ATEC Consulting.
I'm Dr. Jennifer Engstrom. I'm the Director of Pediatric Anesthesia at Long Beach Memorial and Miller Children's and Women's Hospital in Long Beach, California. Today we're here to talk about the principles of donning and doffing to keep everyone safe during this pandemic. So we're going to go through all of the items, and then we'll go through the process, and we'll also talk about how to improvise if you have different equipment available to you.
So here we have two different styles of hair caps, hair bonnet. We have two different types of booties, just regular booties and then knee-high. Gloves, isolation gown, an N95 mask, and another type of mask, a surgical mask that can go over the N95 mask. And then we have a couple different options for eye protection, goggles and face shield. The first pair of gloves, pull them all the way up over the wrist. For high-risk procedures, there are additional items you will need to use. The first item is a powered air purifying respirator. Some have shrouds already included. If they do not, then you can use an item like an ortho hood to help protect your skin. Then you will have an additional gown and gloves.
Hi, my name is Matthew Reed, and today I'm going to be showing you how to properly don and doff a capper. This particular model is the Max Air capper system. You have the helmet itself with the built-in HEPA filter, battery pack, and then disposable lens cuffs. These disposable lens cuffs come in two different sizes. Most people are going to be a medium or large, which is the wavy webbing. And we also have a small for smaller individuals, which the webbing just goes straight across here. So your first step is going to be to take this disposable lens cuff. You're going to install it to the face shield with the webbing facing in towards your face. There's two clips on the side, one in the middle. And you just pop on like so. And when you flip it upside down, you're going to want to pull this webbing out and away from the face just to kind of loosen it up when you install it. And while it's upside down, towards the base of the skull, you have your airflow meter. You've got low, medium, and high. It's a personal preference. It all provides the same level of protection. Most people are on the medium. If you're going to be sedentary or you get dry eyes, you can put it on the low setting. If you're going to be pretty active, you can go to high. And then at the front of the system, you have your LED lights. So green, red, and amber. Green is going to be your battery life. So 3 green lights is fully charged. 2 is 50% to 75% charged. And that's going to be what most hospitals maintain as a minimum. If you go down to 1 green light, that's 25% to 50% charged. And 1 red light means that you're 0 to 25%. If you get an orange light, that means the filter inside the helmet itself has met capacity. In that case, you would just switch out the entire helmet. Now, before you put the system on, you're going to want to plug it into the battery pack. There's no on or off switch, so it'll just start right up. Lights come on here, and once the solid lights go on, you're good to put the helmet on. You're going to reach in and grab the webbing and pull it down around your jawline, providing a tight seal. And the cord and the battery pack is going to run along your backside, and you can just clip it onto a belt or put it in a pocket. Use the ratchet system in the back here to tighten. You should have full range of motion with your capper on. So once you're ready to exit your risk area, your first step is going to be to remove any gross contamination or visible debris. So you go ahead and wipe down the outside of your capper system. That will get tossed. And your next step is to remove the disposable lens cup. So away from people, preferably bent over and down. Just going to grab the sides of the face mask. Just pop it right off. Typically, these go into biohazard, one use, and they're disposable. Depending on your hospital, you can reuse these. If you're going to be with the same patient throughout your shift, just go ahead and decontaminate. We'll do the outside of the lens again, keeping in mind proper dwell time and keeping the material wet for whatever your product you're using. We'll do the front side of the webbing and the inside as well. And then you'll go ahead and store it. Next, you can remove the helmet. Disconnect the battery pack using the black button and pulling the cord. You're going to decontaminate the battery pack itself. We'll do the entire length of the cable up towards the helmet. And then the inside and the outside of the helmet.